Welcome to episode 92 of the ASC Podcast with John Goehle for March 15th, 2020, recording live from our studio in Spencerport, New York. This is Sue Cronkite, Chief Researcher for ASC Podcast and Senior Nurse Consultant for Ambulatory Healthcare Strategies. And I'm in the studio with John Goehle, one of the nation's leading experts in the ambulatory surgery industry. And we're joined remotely, or trying to get it to work. We're being joined remotely by Jenna Alvarez, Senior Nurse Consultant with AHS, Alex Bornemann, Director of Operations for AHS, and I know, Alex, you're here, and Laurie Roderiques, Director of Clinical Services for AHS, and we wanted to thank everybody for joining us. It's just kind of a last-minute thing, and we appreciate it. So, Alex, you're here?
Yep.
Okay.
Yep, and it looks like Jenna is as well.
Okay, good.
I'm here.
Jenna?
Can you hear me?
Hi, Jenna. Yep.
Okay.
And
I'm
I'm here
texting
too.
Laurie. I'm trying to get her there.
Go ahead and vamp, everybody.
Laurie should be coming on any minute.
Okay.
Oh, Laurie's joined.
Hey, Laurie, are you there?
How do I hit the post button? Oh.
Doesn't look like she's called in yet.
Okay.
But I can
But
see.
she's working on it.
Yep.
And we're just waiting for John's
I'm going to kill one of your feeds, Alex. I have two of them here.
Uh-oh.
Okay. And Laurie's not here yet. Oh,
There
there's
she
Laurie.
is.
Hang
She's
on.
dialing in. Sorry, everybody. It's a little trial and error.
Oh, good. I'm on now.
There you
Laurie,
are. You're
here.
on.
Thank you.
Are live.
Okay.
And
So-
John's here.
And I'm here, and I think I've... So here's what's happened in the last half hour. It started with Laurie, as it always does. Laurie
Thanks,
texted.
Laurie.
Thanks, Laurie. Laurie texted me and
Sorry.
indicated that the state of Massachusetts had. Laurie, go ahead and tell everybody what you said.
Well, this evening, the Governor Charlie Baker went on live to give an update on what he has decided Massachusetts would start doing now based on the state of emergency. So within the restrictions that he's imposed in the state, one of the things that he had mentioned was that elective surgeries, hospitals will be directed to postpone elective surgeries to ensure medical workers and hospital space is available. And then, which I sort of heard. And then when the woman that heads up the Department of Health for Massachusetts gave a recap of the key points that they were imposing, she said ambulatory surgery centers and hospital elective surgeries, except under certain conditions, which I don't know what they are, and I'm desperately trying to find out since it's not listed anywhere online. I have reached out to the State Association president, Greg DeConcilis, but he hasn't gotten back to me, and I'm not surprised because I'm sure he's being inundated right now.
Mhm.
Wait a minute. He has gotten back to me.
Oh,
Okay. So his response is, Governor just canceled as of Wednesday to, in quotes, preserve resources. And I won't go anything else that he wrote me.
okay. So let me give.
Yeah, so
Let
that's
me,
basically what it sounds like is happening in the state of Massachusetts.
Okay.
So here's what was happening is when I got the text, I started texting some of our clients, and I got a little overwhelmed because everybody was texting and emailing at the same time and asking the big question, which is this going to happen in New York? Is this going to happen in California? Is this going to happen in other states?
Yeah.
So I just decided to go live. We're just totally winging it here. We have brief note. We're actually calling on our listeners to help us here. I know that I'm looking at the list of people that are on. We actually have 20 people on right now. So thank you all for listening in. I know this was short notice, and this is an incredible
It's a good
format.
venue, I think. Because you can, if you have questions, everybody can hear the answers. And, if you have some information, it's helpful for everybody.
Right. I do see that most of the listeners are clients of ours, which we appreciate, but invite anybody else. It is out on LinkedIn. I had to send like 3 LinkedIns, and I'm monitoring it. And we're waiting for New York. We have a lot of concerns, and again, most of the listeners are from New York right now. I did reach out to Beth LaBouyer out in California. I know that she's trying to get on right now too, and actually she just texted or emailed me and said that she's on. So Beth, if you have any updates, feel free to hit that call-in button, and anything that we can get out there is what's going on in California. We know that many of our listeners are from New York and California just because of the way we sent those links out. So if anybody does want to log on, please, no spamming. I know that we had that problem last time. So I'll probably only invite people on that I can recognize their names. Yes. And then also use the text messaging within the app here. That's another way to communicate with us.
Yep, text in any questions, and we will do our best to answer.
And Sue's watching. We're watching everything we can. Alex is on the line. Let me just tell everybody who we have. Oh, there's Beth. Hang on one second. Welcome, Beth LaBouyer. I assume this is Beth LaBouyer. Beth? Beth, are you there?
Can you hear me? No, but I think she is.
Well, we'll find out in a couple of minutes.
She is. Maybe
it says she's on, but Beth, you might want to check your microphone there. So go ahead, Laurie.
Is it working now? Hello?
Oh, yes, there you are.
There she is.
Well, Beth, you're such a quiet person. It's hard, even in the normal circumstance. I have to jump your volume levels up all the time. So welcome, Beth.
Thanks, John. Latest update I have for California is Governor Newsom just gave a press conference, and no directive on canceling surgeries at this point. I've been reaching out to the California Department of Public Health. However, the state has put in isolation for 65 and older. Everyone should be on home isolation.
Right.
And they've closed some establishments and that sort of thing. So I would think the home isolation for those that are 65 and older would bring a new perspective to, proceeding with any surgery, but no mandate that we have as of yet on elective surgery. Still recommending that surgery centers reach out to their local Department of Public Health and be part of that their local emergency response. So they're plugged in that direction.
Okay. Thank you.
And we have been reaching out to the state of New York. Is anybody from the state? If you are, text me, and then we can. And then Beth just went offline. We do have another slot open. We only have 4 slots. We have 3 of them active right now. So we're up to 23 listeners. So let me just
online, John. Online, there is something that went out this morning, which I imagine you're aware of, out in your part of the world, out Buffalo area, Western New York hospitals. So they're taking a wait-and-see approach on whether to discontinue elective surgeries, following a recommendation by Governor Andrew Cuomo that hospitals may be directed to halt elective procedures to make sure there's enough bed capacity.
And Jenna, you saw something about that.
Mayor de Blasio also said in a press conference today that he's going to sign an executive order on Monday directing hospitals in the city to cancel all elective procedures. So we'll see what that actually entails when it comes out tomorrow.
Yeah, whether it's actually just hospitals or if it applies to others. Yeah.
Right.
We have been getting a number of text messages about abortion, and comment being surgical abortion is not elective. I do understand. I do understand that position. I don't know what the state's position on that would be. And the problem is that ASCs in general are considered to be elective facilities. So we will try to get some clarification, of course, on that if it does happen. Now, let's make it clear to all of our listeners that are just joining that the situation is right now, we do know that the state of Massachusetts has decided to do this, to stop all elective surgery in both the hospital and the ASC setting. We do know that some other states are considering it, and we certainly know that the Surgeon General has recommended it at a national level, but only for the hospitals. So anybody else have any information at this point?
I do see on New York City's website that they have recommended that healthcare facilities are encouraged to implement plans now for canceling elective admissions and procedures, but that is just a recommendation, or they're encouraging it, and just even in the planning phase. That's part of their. That's part of their health update from today.
And I see that this weekend in Ohio, the governor urged that any medical procedures that are not immediately necessary be put on hold. Again, referring to hospitals. So, I don't know if they're just overlooking ASCs or truly not including ASCs. That's a tough one.
I'm sure they're not even thinking about us, right, to start.
Right. No, I'm sure. And the question would remain to those in leadership positions in each state or each state association. Do you really want to ask, or do you want to just continue and plead? I didn't know it said hospital. I know that's the devil side of me speaking, which no one's ever seen.
Jackie from New York City just asked the question, is there something that you can email me that says that, or do we have to wait for the mayor to make it official? Now, again, we have not stated that, we have not heard yet, nor nothing.
He hasn't put out his official executive order yet.
Mm-hmm. And
we're also not sure
that. Sorry.
We're also not sure that it applies to ASCs.
Right now, what he said he will sign says it will be for hospitals. Okay. And it's mostly to prepare for more patients, to take more patients, to clear out beds.
And to also be able for them to have the resources that they need, as in PPE and stuff like that. Mm-hmm. So they don't want to be using it on elective procedures because they feel they're going to need it for those most in need, which are those that are infected.
And I think this is also a good chance for, if anybody's listening that can offer any opinion on, are they beginning to see a change in their volume? Are they seeing issues with their staff getting in because of, the schools closing and that kind of thing? It'd be some good information to share, among us.
The other thing that would be helpful is if any of you have had to shut down for other reasons. For example, on Friday, we did indicate that one of our centers in New York had to shut down because one of the employees had been exposed, and as a result, they had to quarantine all of the employees of that center. I only have anecdotal information at this point. I have reached out to New York State Association, who I have a little more input with, and also I posted on LinkedIn a question to anybody else. So if please text if your center has been closed or has closed as a result of this. We got a email or a text from Peter who says that there are no volume issues yet in his ASC, and he is in Connecticut. And I do so. And by the way, Peter's facility is an eye surgery center. I think what we might be seeing is people, or up until now, people quickly kind of going in and getting their surgery done before they, before things start shutting down. I think it's important to state. I think we all know where we're heading. Mm-hmm. I mean, that's one thing I just want everybody to be prepared for, is that I think it is very likely that one of two things is going to happen. You're going to be forced to shut down, by government mandate, or you won't have patients or the patient volume will drop, too low for you to, financially be able to remain open. Or the last thing, which I think is going to become a major concern soon, is that employees just won't be showing up.
Now, is it possible, though, that as people try to avoid hospitals, that maybe, that will boost the volume in the ASCs, or do you see that not happening?
I don't know. I don't think so. We just got a comment. Physicians over the age of 65 have started to call me today to cancel their surgeries and prepare for self-quarantine. So that's a good point, is that, our older surgeons out there might just themselves not want to have an exposure. That's very good thing to do. One of you is cooking dinner while you're doing this.
The article in Ohio also says that that elective surgeries include dental procedures and veterinary care. Yeah. So I don't know how ASCs are going to be exempt in this.
I agree.
Yeah. And as you said, it could have a lot to do with trying to preserve the limited PPE that's out there right now.
Right. And also make sure that workers are available, the workforce is available. If we need to, many people work in ASCs also work in, the hospital setting. So I think that the demands on their time are going to increase too. Hang on. So in our podcast on Friday, we didn't get to a lot of topics, or we didn't get to all the topics we're going to talk about. So as we're waiting for more information to come in, we're just going to stay on for a while. Our listenership keeps going up right now. We're up to about 29 people that are on the line. So I'm sure you're waiting for more information. As the word gets out, we'll stay on for like an hour to see what happens here. And if the listenership drops down, then we'll cut out. But it is our intention to try to keep everybody up to date. We might be doing these daily podcasts or these daily call-ins, whatever we want to call it, to keep you up to date. It has been quite a struggle for my staff to stay on top of everything. And sometimes, we're just on the phone talking to each other throughout. And I thought maybe just having everybody else listen into what's going on and feed in, that would be very helpful. So I do appreciate everybody that is very patient with us as we get through this. But one of our concerns, and one of the things we never got to on Friday, was talking about the economic consequences of this. And it's already starting to happen. We're, our company, for example, is a very small business, and we're concerned about our cash flow because we know that people are going to have a hard time paying the bills right now, or physically they might not even be in the office to pay the bills. And the surgery centers are the same thing. And I think it's important to recognize that we're going to have to be making some tough decisions. You're going to have to consider what your policies are going to be about paying people who might be going into a quarantine, about what happens, if the government mandate comes down that you can no longer do surgery. Are you going to continue to pay your employees under that condition? Most of us have insurance policies, but you will probably note that acts of God or pandemics are probably specifically excluded in those policies. I don't actually, if anybody has any policies that don't exclude it, I'd like to hear about that. But for the most part, those are standard exclusions. So what we're finding, we live in Monroe County in upstate New York, and on Saturday, this county, as well as all of the surrounding counties, decided to shut down schools until further notice, which of course is causing quite a bit of consternation for the workforce as they try to figure out what they're going to do for daycare. Hopefully, keep in mind, one of the solutions is often, we'll call in the grandparents to take care of our children. But of course, the grandparents are, at an at-risk population. They might not be available, or we might not want to. First of all, I don't know if you always want to subject them to your children.
I know. And I know we've heard many times that it isn't affecting the pediatric population as badly. But they were talking today somewhere on the news, I was hearing that they're believing a lot more of the spread is coming from non-symptomatic people, as opposed to, I know the other day we were saying more symptomatic people are spreading it, which kind of makes sense because they're coughing and blowing their noses or whatever. But they are thinking there's a lot more of the asymptomatic patients out there that are spreading it around. So that could very well be a lot of kids that aren't even showing any signs, but kids are very good at spreading things. So we do want to be aware, even healthier people try to stay away from the high risk population.
Erie County, New York just went up to 7 positive cases, all ranging from the ages 20 to 40. Interesting, Christina.
Yeah.
In Monroe County, we only have 2 cases as of the time that I listened to the news.
But again, how much testing? That's
Right,
what I wonder.
right.
Really.
Well, and I did hear word, and Jenna, you might, either you or Laurie, I did hear that the symptoms in the beginning are mild. And I think I even heard that they might be milder than the common flu that we have right now.
It's almost like you're either terribly, terribly sick,
Right.
or
By the way, Monroe County's up to 8 new cases, or 8 confirmed cases.
Okay. Well, that jumped up pretty dramatically.
Yeah.
That happened like at 7:30, right before you came on.
Jenna, I know you've been on top of this whole testing issue too. I know that you had mentioned that the number of test kits that went out were over 1 million, but the number of actual tests being performed as of Friday, when we last talked about that, was quite a bit lower. I suspect that that's changing.
I think it's changing. I think the states have been stepping it up quite a bit. I think last I looked on the New York State website, they're trying to get up to having 5,000 tests per day. I don't know if they're at that now, but that's their goal. I think the drive-through clinic in New Rochelle was up to like 200 or 300 a day.
Okay.
Laurie, I've had some questions, fielding some questions during the day from some of our clients about PPE. One of the questions was for non-surgical cases, non-sterile cases, can we reuse paper goods? And I think we all agreed that disposable gowns in any situation would be not acceptable, correct?
Correct. And they've even gone on record. It was either the CDC physician, was it Dr. Farros, or another physician, Dr. Siegel, that said you cannot reuse PPE.
Right.
And that was one of the things that they were talking about for like the drive-through centers.
Yeah.
Because theoretically, if you go to the drive-through center, the person that is swabbing you is supposed to be removing everything before they go to the next person.
Yeah.
And the next person. So you think about it, Jenna, what'd you say, 200 people went to the drive-through? That's a lot of PPE. And they also are suggesting that you don't remove your own PPE, that someone else removes it for you.
Oh, wow.
Yeah.
That's a lot of
PPE that needs to be.
Yeah. Well, this strain, the COVID-19 is a lot more easily transmitted than the flu. The flu had a greater number of fatalities, etc. But the spread of this is much more rampant and
by three or four-fold, right?
Yeah. So that's what they're trying to do is keep down the amount of exposures.
Well, and it sounds like there's some debate about what is appropriate PPE. One of the main points of contention right now, I guess, is between the Hospital Association and the Nurses Union about the use of N95 masks versus the use of surgical masks.
So whether it's airborne or droplet.
So from what I can understand, it's droplet, but the particles can stay in perfect lab conditions. Particles can stay in the air for up to 3 hours. So that's why they have the rules in place that if you're doing something that's going to cause you to have aerosols, that's when you need the N95 masks.
Right.
But I think the CDC
for quite a while too.
Yeah, the CDC released their guidance, but I guess the nurses union and the hospitals are kind of arguing over the appropriateness of it.
So I wonder if the drive-through testing centers, because I'm assuming they're swabbing. And
you stay in your car. They were describing it on the news. You're like in your car, and someone in full PPE gear comes up and hands you something.
Because people are probably going to cough.
Well, then I think you close your window again to create the sample.
Yeah.
Stay tuned. Well, I mean, my biggest thought is that using the state of Massachusetts as an example, once one governor does this,
Yeah,
they
absolutely.
probably are all going to march in the same row.
Right.
Because you don't want to be the state that didn't do it and end up having a more pronounced outbreak. So this is just hope they're doing this to be proactive. I mean, even restaurants and whatnot, they're only allowed to do takeout. You cannot eat in restaurants anymore in the state of Massachusetts after tomorrow.
Right.
You cannot go into fitness clubs are closing down. Theaters are closed down. So it's pretty intensive. So they're not doing a mandatory lockdown, but it's as close to that as possible. State workers are on furlough. My daughter works for the Department of Child Services, and they are more so on like emergency call. So they're not going out on their regular scheduled visits because it's too, it's setting people up for exposure. But they are available for emergency type situations. But the state workers are not being brought to work. They're told to stay home. So it's getting kind of foreboding, so to say.
Sorry, we're having.
Nursing homes have now restricted all visitors. So anyone in the state of Massachusetts cannot visit their loved ones in a nursing home or, any kind of residence like that.
We just got an email from Beth LaBouyer, by the way, who gave us an update March 13th. That was on Friday on recommendations for management of elective surgical procedures. This is from the American College of Surgeons.
Do you want me to just read it?
Yeah, why don't, Sue, while we're gathering other information, why don't you just read some of the important parts, especially those 2 bullet points there.
Okay, so information for surgeons. And it just states that guided by the trajectory of cases in Italy and other countries.
Somebody is
typing
on the
like
line.
crazy.
Is typing like crazy or something.
I believe
that's my husband in the background. I'll go on mute.
Okay. What is it?
You all thought it was me.
Yeah, we did.
No, I don't know that you typed that fast, but
that's true.
It's
You're right, I don't.
It's probably Jenna. So it is very likely that the U.S. healthcare infrastructure and resources, particularly as it relates to care of the most critically ill patients, are likely to be strained over the coming weeks. And they mentioned social distancing, crowd avoidance, and other techniques will help to flatten the curve. But beyond that, it is appropriate to be forward-thinking regarding those patients who will nevertheless become infected. So they recommend, as we said, the American College of Surgeons recommends the following: that each hospital, health system, and surgeon should thoughtfully review all scheduled elective procedures with a plan to minimize, postpone, or cancel electively scheduled operations, endoscopies, or other invasive procedures until we have passed the predicted inflection point in the exposure graph and can be confident that our health care infrastructure can support a potentially rapid and overwhelming uptick in critical patient care needs. And the second bullet point is to immediately minimize use of essential items needed to care for patients, including but not limited to ICU beds, personal protective equipment, terminal cleaning supplies, and ventilators. There are many asymptomatic patients who are nevertheless shedding virus and are unwittingly exposing other inpatients, outpatients, and healthcare providers to the risk of contracting COVID-19. Let's see if there's more. Basically, they talk. Yeah, I think those are the main points.
But I think that's, again, that's from the American College of Surgeons. I also do have we knew this was coming, but the presidential declaration of the national emergency opens the door for Section 1135 waiver relief. So this is one of those areas that, remember, Jenna and Alex, we had been looking at and then kind of saying to each other, well, let's not worry about this right now. That was, I think, about 3 weeks ago. just shows you how quickly things change. So
Now, sorry.
We do have an 1135. So Alex, you're probably better about describing this than me. Do you want to describe the 1135 waiver?
Yeah, so the 1135 waiver happens when there's an emergency declared in either the state or a national emergency. And it's something that a facility can apply for that will enable them to ignore certain rules and regulations, mostly having to do with credentialing. So you can take in volunteers, to help treat patients in an emergency, or you can practice outside your scope in terms of, offering emergency care to patients and things like that.
And that's a very good point. If I can just interrupt you for a second, I did have a call from one of our clients this afternoon who asked about that very issue: is what would we do if the hospital is trying to shift cases to the surgery center? And by the way,
at the end of that, the
American College of
Surgeons document that I was reading, and I was just skimming through the rest, and it does suggest to inpatient facilities possibly shifting elective, urgent, inpatient diagnostic and surgical procedures to outpatient settings when feasible. So, that is a
possibility. So if we do, the step would be that they do need to declare a national emergency or a state emergency, which we certainly have declared a national emergency. State emergencies are happening in most states, I believe, in New York. That kicks in the eligibility for the 1135 waiver. Alex and I will start working tomorrow on getting some policies out there for people. We do have a policy. We just never spent much time reading it. So we'll figure out what that impact would be. So this might be a means, if they do allow elective surgery to continue, or at least surgery that's, I guess a point was made that we might even be doing things that we wouldn't normally be consider elective, such as, emergency appendectomies, which if we can move them to the outpatient setting and get people quickly credentialed to do that, that might be a great idea out there. So thank you to my client, Daniel, for bringing that to my attention. I'm sorry, Daniel, I gave you a different answer, but that was before we considered the 1135 waiver and what the impact would be on that. Mm-hmm. So we'll start looking into that. Alex, we should probably take that 1135 policy that we have, and we can post it on the website when I have a chance to get to that area again. So for those of you that are joining us or are not familiar with what we do have a website called ascpodcast.com. If you go to that website, there is an action plan listed right on the front page. It has not been updated since Thursday. We're still trying to get our head above water here, but we keep an eye on that website. I will put notations next to the information to indicate when it was last updated, so that you'll know what we have there. So Alex, you and I need to start working on that tomorrow. Laurie, can you talk a little bit about? I think I want to focus back on infection control, because I have been getting questions from people who seem to be considering loosening their infection control rules, and I think we all agree that's not appropriate, but perhaps you can kind of focus a little bit on that and just kind of talk a little bit about what we can do and what we better never be doing.
Well, just off the top of my head, first off, no, you never want to be lax on your infection control procedures, your policies, your plans. There's no defense in that, whether legal or morally, for your patients or your staff, number one.
Right.
Number two, maybe you want to assign a specific person, an employee. It could be anybody, that you have to be the one that is turning everything over. The only way I would say that's how you could reuse your PPE is if this person is technically just your cleaner that's going, all over the place, cleaning, wiping. You see it right now in airports. You see it in lobbies and whatnot, somebody is spraying and wiping the surfaces and whatnot continuously throughout the day. Granted, that's, in an outside environment, but, we might end up thinking about that, as we said, thinking outside the box. Someone could be in your waiting area cleaning the seats and whatnot, the handles on the doors for patients that are coming in and out or visitors coming in and out. That's a constant battle. No one's going to be cleaning the door handles on their way out, and very few people are using their elbows. And if you're pulling a door to open it, how can you not open it if you're not using your hands? So that might be something to consider. When it comes to direct patient care, you can't reuse stuff,
Right.
So maybe you do your best, to limit what it is that you are using. Keep your distance from from the actual site of surgery if it's an open procedure or whatnot. No longer stand up at the field to talk to the surgeon or the scrub tech, and watch the surgery, closer up. Keep your distance if you're the circulator. Keep your distance if you're anesthesia. Keep the screen up, so that you're not looking over the screen, which, it happens. People talk to each other with their eyes just as much as with their words. So create that barrier the best that you can. Limit as much aerosol as possible, whether it's, in the OR or when you're dumping waste in your hopper or in your sink, things like that. Keep your protective glasses on. If you have protective glasses, keep them on. Protect your eyes. Stuff like that. But it's hard. It's extremely hard. And those of you that have packs, surgical packs that you open on your back tables and set up your sterile field, sometimes you have extra gowns. Save those. Your PPE doesn't have to be sterile. So you can use those gowns as long as they haven't been on the contaminated back field. So if your doctor always uses an extra large gown and you have an extra large gown on your field because he or she's not going to wear that one, hand it off and then use that as a method of PPE for cleaning or in the processing room if it's not a wet area, stuff like that. Same thing with extra gloves. If you have an extra pair of gloves, save it. If you drop a pair of gloves on the floor that normally we might toss because obviously they're not sterile anymore, save it. You can use those as, your cleaning gloves. So fortunately or unfortunately, the ASC world, we're very big on being frugal and not wasting and not opening extra supplies. But there are times when we do have those extra supplies. Save them, use them. Don't bring them home. The people at the center need them now. That sort of thing. So that's just off the top of my head, if that's helpful at all.
Absolutely. Alex, do you want to talk a little bit about what you just sent off at about 1139 waiver?
Yeah. So I was looking for an official
1135
initiation. Waiver. Yeah. And so CMS did have a press release on Friday saying that basically President Trump's announcement that we were in a state of national emergency does enable them to start doing waivers under the 1135 or section 1135 of the national or the regulations to enable the waiver process to begin. So they're going to take the lead really on informing providers where these 1135 waivers will need to be used. So really we'll be looking to them or, our hospital systems or our government to tell us when and where we need to be if we have to be at our surgery centers helping out through the 1135 waiver in a capacity that we wouldn't normally be. They're really who we'd be looking for to tell us to do.
Right. A couple of things just to talk a little bit about here. Trying to see if anybody. Oh, we do have. Oh, I don't know.
I don't think so.
I have somebody trying to call in. I don't recognize the name though. So if that individual that's trying to call in could at least text who they are, I'd appreciate it. One thing I want you to start thinking about is we start shutting down. If you do decide to continue to pay your employees, there might be some things that we can do in order to, maximize the use of our time to, kind of get things caught up. We all know that we are running out of time. I mean, we never have enough time to do everything that we have. Let's put it that way. And this would be a good time to kind of get caught up on things in your facility. If you're going to be paying employees to be at home, if you do choose to do that, you certainly have a right to ask them to do certain things on your behalf, such as maybe it's time to escalate your annual training, to review your policy manuals. Certainly you should be looking at your infection control program. Again, you should be doing that anyway all the time, but taking a hard look at it right now, using some of the tools that we've posted on the website. Consider also revising your emergency preparedness plan and considering, changes, especially, we never really spent a lot of time, I would imagine, on the pandemic, though we should have. Given that would have been the more likely thing that we would have. So look at that. Do some tabletop drills. I imagine it'd be kind of fun to do a tabletop drill over a message. So there's we in our company, I don't necessarily want to mention company names, but we use Zoom, ZOOM. We have a subscription with them so that we can do meetings up to 100 attendees. We actually can do up to 1,000. We just have to pay more at this point. 100 has been more than enough for us to handle. And what's nice about Zoom is it allows you to see the people at the other end, or for them to call in. You can also share screens. To that end, one of the things we're going to be rolling out over the next couple of weeks is some training. We kind of figured this might be a good time to give everybody some educational programming as they're, again, if you're shutting down or if your volume starts to drop, you might have some time to do things. So we'll try to be offering some things to kind of use this time to our best advantage if you're going to be at home, not necessarily working for the surgery center. Not to say that things are going to be totally calm, but those might be some other options there. So we're looking at ways to expedite that. We are thinking about doing quite a number of live podcasts or live format podcasts. Laurie and I have talked a little bit about doing the infection preventionist training, for example, in this type of a format here, giving credit for it, as well as giving you a certificate at the end after you pass a test. I won't make it too difficult for you, but at least so we have some proof that you listen to the podcast. And we have slides. We've already been working on some of those slides, or I should say, Laurie has been working on those slides. So those are options that we might have in the future, just to kind of maximize your time and, of course, really try to learn, from this whole experience.
Hey, the other thing that you can do if you are going to have staff in-house, if you are capable of having them in-house, this is a great time to do a huge cleaning.
Yes.
Clean your center. Take everything out. Check your dates. You can do your out dates. You could go through stuff, see if you're still using things or not using things. It might be a great time to, get rid of the supplies that you're not using to make room for the stuff that you are. Possibly get credit for things that are just sitting on your shelves that you wouldn't even think about till they are expired. But you can do a real thorough cleaning. You can look at your center with a different set of eyes to say, all right, what can I have that's out potentially to an exposure situation that doesn't need to be out? Do I really need to have a whole package of 2x2s for my IV Star kit, or can I just have maybe a quarter of that package? Things like that that we don't always think about. So you this way, you do your inventory. You could find out if you have waste, or you could see the things that you're ordering all the time. So that's no one likes cleaning their house, but it's so much nicer to get paid to do it.
Yeah, that's right.
So, here's an opportunity, take the people that you have. And like John said, go through your policies, really, really go through your policies. If you are accredited by anybody, compare your accreditation standards for whichever organization that you adhere to, and make sure your policies are following along with what their expectations are, so that you will be so far ahead of yourselves. I can only imagine right now in my state, in Massachusetts, we probably won't be doing surveys for the next months with this big, freeze type thing, since they're closing, they're, going to shut down elective procedures. I can't see anybody, the state or otherwise, sending out surveyors if the facility's closed. So you have a great opportunity to prepare.
Right, and surveyors are at risk also. Many of them are as old as Laurie is, for example, and Wayne.
Or older, like John.
So they have been sending emails out to us to make sure that we maintain, stay safe, and certainly I think you're not going to have as many people volunteering to go out and do these surveys. And to that end, I don't think this is going to end anytime soon. On the survey side, you're going to have the surveyors dealing with all kinds of issues. Especially in the hospital setting for quite a period of time. But to that end, if they get wind that you're not following infection control procedures in your center, you can bet that they'll be on your doorstep very quickly. So that's what their highest priority is going to be. And again, the reason that we should not be minimizing this. But as for regular survey activity, as for deemed status surveys, as for credentialing surveys, I do think that it's going to be a while since. I don't think we're going to see any of that anytime in the next month or so, and we'll keep an eye on it. We are in touch with Joint Commission and AHHC on it, and if anybody from Quad ASF is willing to call us, we'd love to talk to them too. We will try to get them on a future podcast.
The other thing, John, you had mentioned earlier that perhaps the hospitals may reach out to the local ASCs to do some of the procedures that maybe aren't elective but can be done in that situation. Well, you know what? You need to prepare for that. You don't want to get the call that...
Whoop. Laurie, are you there?
I think we lost
Alex,
her.
Are you there?
Yep, I'm here. I think we lost her.
It's gonna be...
I think we lost her in the middle of a sentence.
Me? You lost me?
Yeah, she's gone.
Yep.
Oh, how
Are you there?
sad.
No, you're back. You're back. Sorry about that.
I'm so glad you missed me. But, you might want to think about, preparing.
We're losing her. I just got a... Laurie, are you back?
No, that's just me laughing.
Okay. The CDC is recommending that gatherings of 50 people or more in the U.S. be canceled or postponed to the next 8 weeks due to the coronavirus thing. So that is something we've been hearing too. I think that's where we're going to. Listen, that's where we're heading right now. We're recognizing that we're heading in the direction that the type of surgery that we do are going to be shutting down. So let's just kind of do a quick summary. This all started because Massachusetts is suspending all elective surgery on Wednesday for hospitals and we believe surgery centers, or is that absolutely confirmed, Laurie?
I can't confirm it online. I can only say that that's what the Department of Health official stated in her live press conference on the television, on the local television stations.
So we will continue to monitor. We do expect other states to follow. If you're not told to shut down, you might find yourself with volume levels dropping, especially if you serve an older population and those individuals are being told not to go out and do anything that would endanger their lives. So we do expect other states to follow Massachusetts. We've been trying to keep track of that, and we'll keep you up to date. Be prepared for tough decisions about what to do with your staff if you shut down. Are you going to be paying for them or not? If you do opt to pay them, you can expect them to do work for you, and we encourage you to start thinking about things that they might be able to do at home to help you, such as doing their annual mandatory training, if that's something that you can provide them, online or, through a conference call or through a, what's the term? Like Zoom
Webinar
teleconferencing, which is a very reasonable price, by the way. I think it's like $14.95 a month for doing that. You can cancel at any time. And again, I just mentioned the one that we use. There are other options out there, and we'll put some links up on the website if you forget what I've just said. Keep track of all the options that are available to you. Keep track of your 1135 waiver eligibility. We will do more research on this, and we'll get some information posted on the ASCpodcast.com website. Keep in mind that you, in a state of emergency, other organizations or hospitals or the government might ask to use your facility. That has happened in the past in New York City, for example, during Sandy. Some of our ASCs down there were asked to be retasked for other purposes. And then use your time wisely. See if there's anything that kind of get caught up on. I'm sorry, I put that item down twice on my wrap-up list. Anybody else have any other comments to make here? Anybody of our listeners have anything else to share?
My only suggestion is, keep yourself safe.
Right.
Keep your patients safe, your family safe. If you don't feel comfortable with something, speak up. If you see someone else doing something that you don't believe is the right thing to do, speak up.
Right.
It's all about safety. There should be no recourse against anybody, or worst case, bring it to your superiors. The infection preventionists out there, if you're listening, we got to put on our big girl, big boy pants and buckle down and really be surveilling everybody's behavior and practices, because there is no room for error right now.
Right.
There's a lot of people counting on us.
Well said, Laurie.
Thank you.
There are certain things that we are legally obligated to say at the end of a podcast, so we're going to go through that now. That's it for this episode of the ASC Podcast with John Goehle. Join us again, and please consider becoming a patron. That is, it's a lot of money to maintain this podcast, and we're glad to do it. But I really would like to encourage you to consider becoming a patron of our podcasts, and you can do that simply on the web on the ASCpodcast.com website. No pressure. It does help us to pay the bills here. The sound editor for this episode is Susan Cronkite. Executive producer is John Goehle. Research assistance is provided by Susan Cronkite, Jenna Alvarez, Judy D'Ambrosio, Alex Bornemann, and Laurie Roderiques. Music is provided by Media Sushi and Mike Noah. The ASC Podcast with John Goehle is hosted on Podbean and is available in all major podcast channels.
This podcast has been an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. Thank you to our sponsor, Ambulatory Healthcare Strategies. For more information about our services, please visit our website at ah-strategies.com. If you're interested in advertising or sponsoring with the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.